Back in central London, there's no let-up at the CATS office.
Is Kelly here?
There are always at least 2 doctor and nurse teams on duty, and each year they transfer around 1,100 sick kids.
Hi, it's Christian here, the retrieval fellow from CATS.
Tonight on shift are CATS fellow Dr. Christian Pathak and nurse Carol Jones. They've been called to an urgent case 19 miles away in Romford. The third member of the team is ambulance technician Steve White. The call is for a young boy with epilepsy who's had such a severe fit he had a respiratory arrest.
We're on our way to Queen's Hospital in Romford to evaluate and retrieve a 7-year-old child who apparently has a prolonged epileptic fit and stopped breathing in the process.
7-year-old Stephen had a fit at home and became unconscious.
So we knew this little boy had epilepsy from birth on, and epilepsy causes fits, which are basically sudden bursts of electricity in the brain. Now in this case, he had a prolonged fit, which can actually damage the brain very severely.
Stephen's family are used to his regular seizures, which are linked to his cerebral palsy, a condition he's had since birth that affects the brain and nervous system. But this fit was so severe, it shocked them all, especially older brother Eddie.
I have seen quite a few seizures happen in the past. Obviously, it's due to his cerebral palsy. I think this is the worst one so far. It's a lot to handle, hard to hold back the tears.
After a 50-minute blue light drive, the CATS team arrive at Romford. While Carol and Steve transfer their young patient onto their monitoring equipment, Christian looks at the CT images of Stephen's brain to check for abnormalities.
You can imagine the head is being sliced down in a horizontal fashion, and then you look for structural anomalies like a bleed. But luckily, there's nothing to suggest that there's a new problem inside of the